This is intimidating. We had some really impressive moderators yesterday. My colleague and fellow commissioner, Alex Zay, who I haven't even gotten to catch up with. Alex, great job. Liz Grant. To listen to Liz Grant's accent, I could listen to you read the Boston phone book. I would just be enthralled. For you students, see me later, I'll explain what a phone book is. Liz also really inspired me using a blend of the arts and sciences and used some poetry to capture some of the themes that we've been emphasizing. And I want to try and bring what I hope is an American, or will be an American classic poem, to capture some of what we learned going back to the opening reception on Friday evening on through yesterday. Jonathan hinted Trump is dumb. Howie told us numbers numb. Michael conveyed that it's a new dawn. Susanna and Giulio said, just get a prawn. Chris lamented a lack of fish. Anne seeks new fruits for her dish. Jesse was clear that drought is bad. And delaying happy hour made Nick Watts sad. So with that, I'm here till Thursday. Okay. So I want to get serious here. I want to catch us up, make sure we're all on the same page. So I'm going to start off by reading the full definition of planetary health from the Lancet Commission, because I think we only got snippets of it yesterday. So bear with me. This is from the Rockefeller Lancet report. Planetary health is the achievement of the highest attainable standard of health, well-being, and equity worldwide through judicious attention to the human systems, political, economic, and social, that shape the future of humanity and the Earth's natural systems that define the safe environmental limits within which humanity can flourish. And as Richard summarized yesterday, the shorthand was, put simply, planetary health is the health of human civilization and the state of the natural systems on which it depends. But what does that mean operationally? To answer that, I want to give you a working definition of planetary health. For me, planetary health is a field focused on improving our understanding and ability to measure the public health impacts of anthropogenic environmental change, so as to inform decision-making in the land use planning or ocean use planning, environmental conservation, and public health policy realms. This working definition is very important in that what cannot be measured cannot be managed. And as Jonathan mentioned Friday evening, our task is in many ways to allow, perhaps even to demand, that the public health consequences of natural resource management decisions be explicitly factored into those decisions at a range of scales, instead of remaining in the realm of vague and poorly quantified externalities. I think that's fundamental. So how do we do this? How do we maximize our chances of having our science move into policy and action? And that's what this next session is all about. Now, there's no silver bullet, but there is one clear lesson I want to emphasize this morning from personal experience and from the literature. The single most important thing we can do is to involve decision makers, whether they be women heads of household, communities, local agencies, national governments, involve decision makers in our research from the start, in the earliest phases of planning. Science simply has to be salient to those who are in a position to use it, and securing early buy-in is the single most critical thing we can do to increase the chances that our research will have impact. So you've got to know in advance, who's your audience? What are their needs? What do they need to know? What makes them tick? If you think that if you build it, they will come, you will likely be professionally disappointed. So this morning's presenters are each working at different scales, but they are all essentially trying to guide or alter human behavior, which is, to me, the definition of policy, whether it's policy with a big P or a small p. It's really about changing behaviors. So I guess the bottom line is, and I think this was very clear yesterday, I think we all know that the sound science is necessary, but it's far from sufficient.